Hi, everyone. Welcome. Thank you so much for coming. It's good to see some familiar faces, and I'm so grateful that we're recording so people can see Lily's wonderful work who can't be here today. I'm just going to give a really brief, Lily, before we put the slides up, I'm just going to introduce myself really quick, and then I'm going to give a overview of my original study in 2016. So we're going to go back 5 years in time, and then I'll introduce Lily. So as Liz mentioned, I got my MPH, Master's in Public Health from the University of Washington. I now work as an analyst at the Tacoma Pierce County Health Department as my day job, but I'm a lifelong Hanford Challenge volunteer. And I'm a downwinder. I grew up downwind from the Hanford nuclear site in Moscow, Idaho, where my family lived. And I didn't know much about Hanford. I became knowledgeable and interested in Hanford as an undergraduate student at UW. I took Holly Barker's class on environmental policy. And it just kind of connected the dots for me and taught me, my family's nuclear legacy of health issues and increased mortality, and just really made me interested in taking action and being a part of your team and doing this work. So for my MPH capstone, I decided to work on this topic, and I just really wanted to know, besides downwinders, who's being impacted by the Hanford site with health risks. And it was workers. In 2015 and 2016, there was an increase in vapor exposures. It was all over the news. And so that's kind of what led me to choose this topic. So I'll start out. Lily, you can go ahead and share the slides. And this was my capstone thesis. Liz mentioned that I'm clinical faculty at UW. That actually just started, which led me to work with Lily as a student. But this was my graduate student project in 2016. Advising committee was Amy Hagopian, Holly Barker, and Steve Gilbert. Steve's with us today. And my on-site mentor was Liz here at Hanford Challenge. And I was funded by the Northwest Public Health Training Center, which was great. I had a grant to travel out to the Tri-Cities to interview workers. So just kind of a recap of, again, what was going on in 2016. There was like 42 vapor exposures during 1 week of April 2016 alone. There was still a real increase, which of course prompted the lawsuit, and the suit claiming handling and treatment of hazardous waste at the Hanford site present an imminent and substantial endangerment to human health. So as a public health student, I was very interested in this. My research question simply was, what are the experiences of Hanford nuclear workers who navigated these compensation and healthcare systems? Lily beautifully states in her recommendations of her report that these workers have become experts in navigating these systems, and they know what they need. So as public health practitioners, we are here to simply amplify their stories and voices in this qualitative format. So the problem again was, this was an additional problem that I noticed, was the lack of documentation and peer-reviewed academic study around the experiences of Hanford workers. With the exception of newspaper and TV media, there's been little reporting on this. And as many of you know, there's very little epidemiological study on the risks, the health risks of the Hanford nuclear site to the public and to Hanford workers. So I really wanted, as a student, I really wanted to add to this body of research with publishing too, which we'll be attempting after Lily's report is finished. So I conducted 6 interviews with workers, and they were in their homes with their families. Some of them were very long, like 2 hours, audio recorded, and all participants were asked the same set of questions. The questions address things like the setting and circumstances of exposure incidents, employer and coworker responses to their incidents, navigating the compensation process, and also on-site and off-site medical care, and overall perceptions of risk and exposure prevention. So next slide, please. So, and in the interest of brevity, I'm not going into like technical methods or anything. So if anyone's interested, we do have a written report for this study that I can share later, or Liz could share if you have questions about the methods and things. So the 5 themes that came out of this that the workers really highlighted were that participant exposure incidents occurred frequently and similarly. under similar circumstances, including things like weather systems, the smells that they experienced, and their immediate symptoms. The weather systems was really interesting, and this was again back in 2016, so I don't know if it's been looked into since then, but at the time we had no evidence of the Department of Energy actually looking at that phenomena. Theme 2 was management downplayed the risk of exposure. Employers showed a lack of concern for participants, and the on-site safety trainings also downplayed the risk of exposure. And additionally, theme 3, the coworkers were skeptical of exposures, denying or even mocking participants, and there was even bullying that would go on, for example, saying that they were faking it. So this culture of denial and secrecy was evident. And then fourth, the participants experienced unsympathetic and conflicted medical care, both on-site and off-site. And off-site providers, such as providers showing reluctance and even refusal to diagnose or treat patients. And theme 5, workers reported that their similarly exposed colleagues often disappeared or died if they failed to take action and fight the system. So it was clear to us that the 6 workers that we interviewed were probably not the norm. They had reached out, they'd taken action, they'd contacted Hanford Challenge, but they spoke frequently of their colleagues who weren't doing that, and sadly just kind of disappeared. So in conclusion of kind of this study that I did in 2016, I really focused on culture. I also have a background in anthropology, so I was really focused on the safety culture at Hanford, and not encouraging reporting exposure incidents, and that this kind of Cold War culture of secrecy still exists, and that the compensation structures may compromise the duty of medical providers to evaluate objectively a patient's health. And that is something I'm very much interested in now, and as you'll see, showed up in Lily's, oops, my goodness, excuse me. You'll see also showed up in Lily's research. So for all of you professors who are listening and folks working on projects around Hanford, I want you to, as you listen to Lily's project, consider future practicum and capstone projects for students. There's so much that could be sort of a relay project from this. Lily and I are what our director of COPHP says, relay projects. I'm passed the baton to Lily, and Lily is ready to pass the baton to another student. So I'll be submitting capstone ideas in the next couple weeks, which a student could get started on as soon as this summer, and then practicum start in January of 2022. So think about that as you listen to the next presentation. And with that, I'll pass the baton to Lily. Thank you.
Thank you, Emily. And thank you everyone for being here and coming to listen to what I found during this project. My name is Lily Dearwater and my pronouns are she, her, hers. I'm a first-year student at the University of Washington getting my Master's of Public Health in the Community-Oriented Public Health Practice program. During our first year, we spent January to June working on a practicum project. My practicum was with Hanford Challenge, working on a follow-up to the study Emily just talked about the experiences of Hanford workers who have been exposed to chemical vapors. I want to start by thanking all the participants who trusted me with their experiences. I also want to thank my project supervisor, Emily Turk, my faculty advisor, Geeta Krishnaswamy, and everyone at Hanford Challenge who helped me with this project. Liz Matson, who was my secondary supervisor, Tom Carpenter, and Nicholas Peterson. I also want to acknowledge that the land on which University of Washington and Hanford Challenge sit today is the traditional land of the Coast Salish peoples, the tribes and bands of the Duwamish, Puyallup, Suquamish, Tulalip, and Muckleshoot nations. Without them, we would not have access to this learning and working environment. I also want to acknowledge the original caretakers of the land occupied by the Hanford nuclear site, the Wanapum, the Confederated Tribes and Bands of the Yakima Nation, the Nez Perce tribe, and the Confederated Tribes of the Umatilla Indian Reservation, the Cayuse, Umatilla, and Walla Walla tribes. I want to acknowledge the continued harms caused by displacement from the land and the ongoing contamination of the soil, the air, and the Columbia River. So I'm going to provide some background, even though I know a lot of you are already pretty familiar with this. The Hanford nuclear site is owned by the United States Department of Energy, DOE for short. The site produced plutonium for atomic weapons during World War II and the Cold War. Producing plutonium created a massive amount of radioactive waste. We're talking billions of gallons. 177 tanks on the Hanford site hold 56 million gallons of the most hazardous waste. Other waste was simply released into the Columbia River or into unlined trenches. The tanks are also getting old and starting to leak. Nuclear waste from the Hanford site has contaminated the air, soil, groundwater, and the Columbia River, endangering people and wildlife today. In 1989, the DOE entered into the tri-party agreement with the Environmental Protection Agency and the Washington State Department of Ecology to develop a legally binding timeline and schedule for cleaning up the waste. It was supposed to take 30 years. It's already been over 30, and the process will take at least another 75 years and cost over $300 billion. Over 8,000 people work on the Hanford site, contributing to the cleanup effort. There are a number of ways that people who work at Hanford can be exposed to harmful chemicals. This study focuses on vapor exposure. Over 1,800 chemical compounds have been found in vapors that escape from Hanford's tanks. Many pose a threat to human health. Human health effects include brain damage, lung disease, cancer, difficulty breathing, burning skin and lungs, increased heart rate, and more. In 2014, a panel of nationally recognized experts conducted an assessment and concluded that a causal link does indeed exist between chemical vapor releases from Hanford waste tanks and subsequent adverse health effects. When a worker experiences these health effects, they can file a state or federal claim to cover healthcare costs and any additional compensation. My practicum focused on the state process. The Department of Energy is self-insured. They process claims through the third-party administrator, Pencer North America. Pencer handles most of the process. They gather evidence from the people involved to make a recommendation. Washington Labor and Industries, L&I, has the final say over whether claims are approved or denied. A worker can then appeal the claim if they choose. The DOE provides money for these claims when they're approved. A 2006 report by the Government Accountability Project revealed that in 2004, Hanford workers' claims were denied at twice the rate of other self-insured entities. Emily described her project a few minutes ago, and this project was the basis of my practicum, which adds a longitudinal component to the study in light of the 2018 Hanford presumption law. The law states that for certain conditions, including respiratory disease, heart problems within 72 hours of exposure, beryllium sensitization or disease, neurological disease, or any of 22 specified types of cancer, it is presumed that a chemical vapor exposure at Hanford caused the condition. Prior to the law, the burden of proof was on the worker during the claims process. They had to prove their condition was because of an exposure, not because of some outside factor, such as a history of smoking. With the law, the burden of proof was shifted to DOE's third-party insurer, Pencer. If they want to deny a claim, Pencer has to prove that the condition was caused by something outside of Hanford. The federal government promptly filed a lawsuit against the state of Washington to overturn this law. After multiple appeals, the law was upheld in 2020. The purpose of my practicum was to see if anything had changed for the workers Emily interviewed or others with similar experiences after the passing of the law. We also wanted to know what more was needed to support workers navigating healthcare and compensation claims. I began with formative research, conducting a literature review, interviewing 4 key informants, and analyzing L&I claims data. The bulk of my presentation centered around interviewing workers. I interviewed 3 workers from Emily's study and 2 more workers from a list provided by Hanford Challenge with vapor exposures prior to 2016 and open claims. We only recruited people who had contacted Hanford prior to the study, or Hanford Challenge. After conducting the interviews, I analyzed the transcripts in Atlas TI using inductive qualitative analysis. This means I didn't start with codes or themes beforehand. I created them based on what I found in the interview texts. I then sent the themes and an early draft of my report to participants, so they had an opportunity to provide feedback and make sure I had represented them accurately. I synthesized my findings in a report that I shared with Hanford Challenge, and will continue to edit this report for eventual publication. Of the 5 participants, 2 were still working at Hanford and 3 were no longer working at all. Participants had worked a variety of jobs on the Hanford site, including health physics technicians, instrument technicians, and operations roles. All 5 of the participants were still experiencing symptoms related to their exposures, including asthma and other respiratory issues, cancer, diabetes, pulmonary hypertension and other lung conditions, skin conditions, heart problems, and toxic encephalopathy and other neurological conditions. 3 of the 5 participants provided demographic information. Of those 3, their average age was 62, and they had worked at Hanford for an average of 30 years. All 3 were male. 2 showed their race and ethnicity. 1 identified as Mexican and the other as white. The interviews with these workers revealed 5 themes. 1, the 2018 Hanford presumption law sounded good to all participants in theory, but its effect on participants' compensation claims was inconsistent. 1 person had their claim go through under the law. Another said, "Just because it didn't work out for us, you know, I still think it was good that they passed it and it got upheld." 2, it takes a lot of effort on the part of the workers to navigate the compensation and healthcare systems. These systems do not support or prioritize workers. The Department of Energy influences every aspect of the process and has created a hostile culture of secrecy and denial. These quotes barely scratch the surface of all the stories I heard about workers struggling to navigate safety, healthcare, and compensation. It's all about power and money. It's not about the workers or their health and safety, not at all. All I can say is Department of Energy has a lot of pull. That's all I can say. 3, quality healthcare is extremely limited for people who have experienced vapor exposures. Participants described missing diagnoses, lack of expertise, and conflicts of interest. Hanford workers face barriers to accessible care, and medical providers face barriers to providing care for the workers. 4 out of the 5 participants described struggling to get the health care they needed. 1 said, "It seems that whenever we see a doctor and they find out that it's Hanford related or to that effect, they really shy away from helping us, or they say, oh, we can't, we don't deal with that." 4, there are major gaps in on-site safety protocols. Interviewees described training that downplayed the risk of exposure, limited monitoring for chemicals, and a respirator cycle where respirators stop being required when exposures go down and then become required again when exposures go up. 1 interviewee said, "I don't want to belabor the point, but the site was not conducive to safety, still isn't." 5, participants proposed solutions, including improvements in medical care and systems where workers who had experienced exposures could support one another. These were the most common solutions, but participants also talked about holding management accountable for safety and a need for the culture surrounding Hanford to change. This quote sums up a common attitude among the participants. "I'll be dead by the time it helps anybody else, but let's do it. Let's get this fixed." While I met all my project goals, the study did have some limitations. We were unable to find all 6 participants from the 2016 study and only found 2 more people who met our criteria, bringing the total number of interviews to 5 rather than to our goal of 6. I was unable to visit the area around Hanford and had to conduct all interviews virtually due to COVID-19, so may have missed some nonverbal cues. I also may not have been able to see the full effect of the law. The lawsuit only ended in 2020, and multiple sources told me that until that time, Pencer acted as though the law didn't exist. There may be more changes to safety and claims procedures after the pandemic. This study focused on occupational health and workers' rights. We emphasized the right to a safe work site and the right to health care. Hanford workers are not receiving equitable medical care. Their workplace is not safe. Exposed workers are often low-level laborers at a lower socioeconomic status. This project just begins to address environmental justice issues relating to the Hanford site. Workers are far from the only people affected. The environmental harms caused by Hanford negatively impact many people's health, including people who live downwind of Hanford and people who fish in the contaminated Columbia River, especially the native peoples who were forcibly displaced from the land on which Hanford sits and who practice their traditions along the Columbia River today. There is no up-to-date or culturally relevant guidance on fishing in the river or practices alongside it. Another lens through which to explore Hanford is through their history of systemic racism. Hanford recruited Black workers in the South in the 40s to help build the site. Hanford made living nearby extremely difficult for these workers and refused to hire them, most of them, for long-term jobs once building was complete. This was not the focus of this study, but exploring the impacts of this legacy of racism today would add to this work. The Hanford workers who have experienced injuries and illnesses from chemical exposures have become experts in navigating the compensation and healthcare systems. They know what they need. The recommendations included in my report are based on their concerns and ideas and supported by the literature. Hanford workers need better access to quality, unbiased healthcare. Participants struggled to find specialists and medical providers who were willing to treat them. One participant suggested an independent clinic where specialists could come to the Hanford area to study chemical exposures. The availability of unbiased expert healthcare for Hanford workers needs to be increased. We also recommend additional qualitative research, talking with healthcare providers treating conditions related to exposures to understand their needs and barriers when it comes to properly caring for their patients while navigating the workers' compensation process and the culture surrounding the Hanford site themselves. The upcoming Hanford Health Energy Workers Board recommendations from their healthcare survey earlier this year will also add information on how Hanford workers' healthcare needs could be met. Multiple participants also mentioned ways that workers could officially be part of the process and support one another, from implementing a program where workers would have more authority over safety on site to hiring workers who'd been through the claims process to help others. In terms of the claims process, this does exist in the form of the Hanford Workforce Engagement Center, HWEC, which was created in 2018. HWEC has helped thousands of workers, but they are under the umbrella of the DOE. They could lose funding if they lose Senate support. Accountability is also crucial, both for management, perpetrating a culture of secrecy and denial on site, and for Penser during the claims process. L&I either needs to hold Penser accountable for following the 2018 law or take over the process entirely. Finally, on-site safety needs to be improved. Hanford should keep workers on supplied air, respirators, instead of taking workers off supplied air when exposures go down. They should also work to improve chemical monitoring and examine the health effects of combinations of chemicals. The final element of the project is still ongoing. I'm working with Emily and Hanford Challenge on publishing this report so it can be a resource in the future for people studying Hanford and working to improve conditions for workers. Thank you for your time, everyone.